Hello, I am Dr. Atul Limay. I am the Director of Interventional Cardiology and TAVI Services at Fortis Hospital, Mulund. Today we are going to understand what is a leaky heart valve. To begin with, there are four valves inside our heart. These are called the mitral valve, aortic valve, tricuspid and the pulmonary valve. Valves inside the heart are created to allow blood to flow in one direction only, so that when this valve is open, blood flows from one chamber to the next chamber in a coordinated fashion. Sometimes, due to rheumatic heart disease or due to age-related changes in the heart valves, the valves become leaky and they no longer function normally as they should. So the blood leaks in one chamber or the other when it is supposed to be tightly shut. The common valves that leak are the mitral, aortic and the tricuspid valve, particularly in adults. When the valves start leaking, as you can imagine, it puts pressure on one chamber or another. So for instance, when the mitral valve starts leaking, it puts pressure on the left side of the heart because the mitral valve separates the left atrium and the left ventricle. So the left atrium and the left ventricle start to dilate. Similarly, when the aortic valve starts to leak, it puts pressure on the left ventricle, the left side of the heart, thereby impairing the function of the left ventricle, which is our main pump. When the tricuspid valve starts leaking, it is a valve on the right side of the heart that separates the right atrium from the right ventricle, and this leads to enlargement and dysfunction of the right atrium and the right ventricle, the two chambers on the right side of the heart. Typically, this leaking of the valves causes dyspnea or shortness of breath and undue fatigue to patients, which is when they come to the hospital or see their doctor for attention. Accurate understanding of how much the valve is leaking, it is done by echocardiography. When the valve leakage is mild or moderate, the treatment recommendations are mostly with medications and lifestyle changes. When the leakage becomes severe, surgical considerations or non-surgical alternatives to replace the valve come into play.